Welcome to Big City, Small Town, the podcast about the people who make San Antonio go and grow. I'm Corey Ames. Today's guest is Ariana Chaudhary, the founder of ASK, Access to Specialist Knowledge, a nonprofit that connects frontline doctors around the world with volunteer medical specialists to help them solve tough cases in real time. Ariana launched ASK at age 14 after a family trip to Uganda, where she saw firsthand how a lack of access to medical expertise was costing lives. So she did something about it. Now she's 17, a student at Health Careers High School here in Northwest San Antonio, and she's helping save lives every single day. And in this conversation, we're going to talk about how she built ASK, what she's learned as a teenage nonprofit founder, and how San Antonio shaped the way she sees the world and her place in it. Let's get into it. Ariana, welcome to Big City, Small Town.
Thank you so much for having me.
Well, to get us started, I'd love if you could tell us in your own words about your nonprofit, Access to Specialist Knowledge. What does it do?
Yeah, so Access to Specialist Knowledge is this organization I founded in 2022 to combat disparities to healthcare and access worldwide. And so kind of what our main focus is connecting healthcare workers in underserved areas of the globe, such as in sub-Saharan Africa, South Asia, and South America, to board-certified U.S. medical specialists to ensure that even if there's no physical specialist present in the area, quality healthcare can still be delivered.
Incredible. Well, you got to tell me, you started in 2022, so
Yes.
that was when you were 14 years old,
Yes.
if I'm not mistaken. So if you could share with us the story as to why you started the organization then, what was the experience, the idea that you had?
Yeah, so I think the biggest inspiration for Ask started from exposure to the issue. So in 2022, I traveled to Uganda with my family, and due to an injury, we had to visit one of the clinics there in the outskirts of Burundi. And kind of at that moment was the first time I saw the kind of stark contrasts from the healthcare I was accustomed to in the US. So in that clinic, there were only two nurses handling, what seemed to be hundreds of patients. And they were doing practices and treating and aiding to these patients in things that seemed outside of their scope of practice. That was a treatment meant for, doctors, for specialists. Yet, due to the lack of staffing in that area, they were forced to be in these roles that asked so much of them. And, I think anybody at that moment would have their sense of justice and their sense of morals really stirred. But then again, I had really no clue what to do in that situation. I was at that moment, I was with all the patients, like just as another person in that healthcare system. And kind of like what this culminated into is at the end of like our visit and getting checked up, I exchanged contact information with one of the nurses there. And I guess at that point of time, that was about it. Like, I guess the only thing I felt I could do was stay connected to try to learn more. But I really felt at a loss at that situation because, I was 14. I had no clue what to do. But I wanted to do something because, just the exposure to those just stark contrasts. So back in the US, so after the trip, I was going to write a report on kind of the differences in healthcare in the United States and in Uganda. And so I reached back out to Nurse Florence, the nurse I got in contact with, kind of to learn more about the patients she sees, the difficulties that she faces on a day-to-day basis. And she responded to me, and we kind of talked about the things that she's struggled with. And throughout that talk, she shared with me a few of the cases that had been particularly challenging with her. One of the first cases she sent to me was about regarding a girl with partial paralysis. And I guess I felt like that same sense of helplessness again, as, I at this moment also didn't know what to do, because she presented me with this problem and this challenge that she's been facing me. And, just writing about it and just noting about it didn't feel like enough. So what I did was I contacted my pediatrician, since it was a 12-year-old girl, to see if there was any advice she could pass on to Nurse Florence to deal with this case or similar cases. And it was kind of like just in an effort of like naive earnestness, just to see if I could do anything to try to make this situation better for that clinic over there. And, my pediatrician responded. She recommended a trial of like anti-seizure medication, and I passed that note back on to Nurse Florence. And then about 2 weeks later, Nurse Florence came back to me and she told me that it helped this girl and that her symptoms, went away. And I guess at that moment I was really just like flooded with like this relief and disbelief that, that something had helped, that something I did could have been of use. And from there, I started looking into seeing if there was any other larger service that could have done what I like haphazardly tried to do, right? Connecting Nurse Florence, one of these underserved healthcare workers in this clinic, to more specialized individuals in the US. And I looked and I couldn't find anything. And from there, I guess that started my steps to try to pioneer what's now Access to Specialist Knowledge, a system that helps connect these underserved regions to medical specialists here in the U.S.
Mm-hmm. Well, I love that you really take note of the helplessness that you felt in those experiences, as if that might be unique to you or perhaps someone of your age, because I think I would feel the same, if not more. And I'm quite impressed with your willingness to take action. And I'm curious, why do you think that's the case? There's a lot of people that might have that experience and certainly feel some empathy, some concern, and of course that helplessness, but not a lot of people might take the action to then see how they could solve that problem or serve those folks in any sort of way. So what do you feel like is unique to you, your situation, your experiences that had you not just have the experience, but actually lead it into something that has become access to specialist knowledge?
I think one of the things is, maybe it's just being so young, but I haven't really developed like a fear yet. the fear of being like too awkward or too forthcoming. So, emailing my pediatrician, like looking in retrospect, that was very like a very bold move to do. But, it allowed me to find that people are so willing to help if we are able to take initiative. And, kind of not being bound by the fear of like being too much or being too forward has allowed me to find a lot of people who are so willing and so compassionate about the people around them, but who just need an avenue to do so. So I guess that was the main thing of, trying to take the steps to help, even like in this drenched in like this helplessness. But yeah.
And do you recall feeling any sort of doubt, or were you just moving one step after another?
Oh, absolutely. Like all the time, in some moments I'm like so bold and so like forward, and at other moments I feel this uncertainty that maybe what I'm doing is harming more than helping. Because ultimately I'm dealing with a system that is so different from our own in America, and cultural nuances that I can only begin to understand. And so but from there, I think those uncertainties and those doubts kind of force me to ask better questions, to seek better mentors and to really never assume that I have the answers, because that curiosity and that persistence to gain a better understanding is ultimately what can make Ask better and what can make the system better and what can help these individuals better. So,
Absolutely. Well, and this isn't just a handful of cases. From what I got when I first encountered your work in a piece in Texas Monthly that was at the start of 2025, I saw it was recorded some 27,000 consultations performed. Where's that number at now? We're about midway through the year.
yeah, so now we're up to around 35,000. So I guess how we've gotten to that point is when I first started Ask, Ask started a very small scale with like this one clinic or one or two clinics in Uganda and just a handful of healthcare workers here in the US. And it was primarily just me manually like taking those cases from WhatsApp or from email and then manually determining what specialist it is, then sending that to the appropriate specialist. And I remember like those freshman year in high school, like I lived at like the library, just constantly doing this task. And yeah, just doing it very manually. And that really capped the efficiency of Ask, as there is only so much I could do in a day. And kind of as Ask began to grow, as I reached out to more medical specialists here in the US, and as kind of growth occurred more organically in regions of sub-Saharan Africa, as the help of Ask spread through word of mouth, I kind of realized that, okay, no matter how many student volunteers we have, manually triaging cases wouldn't be sufficient. So now what we do to kind of facilitate the process is I developed a system that underserved clinics and healthcare workers there can input the case, the patient history, and other relevant information like tests and scans done. They can select the specialist that they think is the most appropriate for the case, and then they'll send the case, and it directly goes to the specialist's in the US inbox. And if the specialist is busy at that time, they have a chance to re-forward the case, where if we have multiple of the same specialist, it'll go to the next one. Or if not, I'll get a notification and see what I could do about it. So that building that platform has been so integral in really propelling the growth of Ask and enabling us to handle a much larger caseload.
Well, and I love the picture that you've painted there of what things look like today. But I'm curious, going from just reaching out to your own pediatrician to perhaps reaching out to other specialists and doctors across the United States, that must have been a big step, and getting yeses there for people to believe what you're doing is maybe one legitimate,
Yes.
and two, a very worthwhile. What was that process like, and what avenues did you explore to get other specialists across the United States involved?
Yeah, so I think I owe a lot to the growth of Ask in the United States and the acquisition of specialists to this organization, to the many like communities and programs here in San Antonio. So I guess firstly, I go to Health Careers High School, which is a magnet school for students interested in medicine, research, pharmacology, and like other aspects of STEM, or particularly sciences. And one unique thing about that school is many of our teachers are past workers in the healthcare field. So throughout school, I would often talk to my teachers about this and see if I could leverage the connections they had to see if I could reach out to any of the specialists that they knew, since they're already so well-versed and well-connected in the field. So Health Careers has been such a major platform to recruit and find new specialists. Also, at the Audie Murphy VA hospital, I was a volunteer there, or I continue to be a volunteer there, and kind of being able to volunteer directly amongst doctors allowed me to, build more connections with them and be able to really talk in person and tell them more about Ask, like right there, as well as, understand how to make Ask better, right? By seeing how their day looks and what would be the most optimal way to, allow us to be easily integrated in their lives. And then I guess the last place which allowed me to, our last major place that allowed me to recruit more specialists was at UT Health. So I do research there through the Volker Biomedical Research Program, and that's this really amazing program to allow students to get acclimatized to the research environment and gain a lot of professional and pre-professional skills. And through there, I was able to find specialists associated with the university hospital and leverage connections off of research mentors and those who do clinical trials.
Well, and clearly the demand for what Ask does is there, as you mentioned, some 35,000 consultations to date, and that's in just about 3 years. And so for those of us who might not be aware to how extensive this lack of access is throughout the world, could you paint a picture for us? What might someone like myself, who's not as keen or into this problem as you are, might be surprised to know about it, or should know about it?
Yeah, so the disparities in healthcare access falls under public health, global public health. And I think that question really delves into why is global public health so important and what are the current disparities there. So, Ask's focus is sub-Saharan Africa. And in these regions, we see that there are as few as 1.3 healthcare workers per 1,000 people, which is 4 times less than the global standard. We see that there's 0.2 doctors per 1,000 people, and we see that there's close to no specialists in these areas. Despite this, sub-Saharan Africa holds 23% of the global burden of disease. We see the highest rates of maternal mortality rates, which is completely preventable, and neonatal mortality, children under 5, infants, and these are all preventable deaths. Yet still, these hotspots of disease are only served by 3% of the global health force. So what public health teaches us to ask is it okay that we're letting these deaths happen when they're completely preventable? Is it okay that we're letting geography dictate whether somebody has a right to live, whether somebody has a right to good health? And what I think Ask does is it seeks to say, no, this isn't okay. Because we have the technology, we have the resources, we have the knowledge. The only thing that's missing is the connection to these places. And I hope that Ask continues to be this connection to serve these hotspots of disease, yet the most unequipped people.
Is there any sort of overlap or parallel to this, to how this may exist or be replicated in some way in the United States? Because I would imagine, and I'm just making assumptions, that a Lakey, Texas, or whatever, a small town, 2.5 hours or whatever, west of San Antonio, might not have the same access to specialists that we do here in this city. Do you feel like, are those connections already being made in the U.S., or is that an issue here within our own state, for example, and region?
Yes, it absolutely is an issue. And kind of after working on Ask globally, I was able to also turn locally as well and see these problems are persistent across, like, no matter what the nation is, no matter what the city, no matter, I guess, irrespective of geography. And I guess one thing that kind of goes along with that is in my school, I founded this club called Neighborhood Health Screening Club, where we go out, where me and like a group of students, we go out into the communities and we provide free health screening to immigrant populations and populations of low socioeconomic status, in hopes to incentivize further visits to clinics. I guess seeing these disparities across the globe, like the first exposure being in Uganda, it made it easier to recognize patterns, especially here in San Antonio, and kind of really prompted the developing of that club and prompted this desire to go out and try to combat healthcare access, in San Antonio, in our own communities.
Incredible. Well, maybe this is a little bit more speculative, but I'm curious anecdotally, have you noticed anything in the exchanges between yourself, either specialists throughout the U.S. Or likewise the communities in sub-Saharan Africa, in the extent of this most recent administration change, to where we're seeing in the U.S. Doctors and researchers considering leaving the country to practice in maybe more science-friendly type cultures. And maybe at a time when we're looking a little bit more inward as a country than we are outward. Are you seeing any changes in the culture of the exchanges between the doctors, yourself, and these various communities across the globe? Not to say that the demand still isn't there. It certainly is, in fact, maybe even more so.
Expansion-wise, it has been more difficult to recruit new doctors, especially as I feel like these times are very unstable, especially for people in the field of medicine and in the field of science. And given that instability, they feel less, they'll feel less likely to take the risk and contribute, or put more on their plate to contribute to access to specialist knowledge. I guess given these kind of tangentially related, given these new administration changes, particularly the defunding of the USAID, we've in ASK, we've been seeing this major increase in HIV cases. So kind of just directly seeing the impact that now this, public health crisis is occurring. And kind of, I've seen that with ASK, and I believe it'll continue to kind of digress in that way. Our cases will continue to grow because in these preventable diseases, because of changes to the United States, we've dropped out of so much of our funding and set a precedent for many other countries to drop out of funding, that now especially these other organizations like Gavi, which provides free vaccinations, have been also facing similar crises. And we've been seeing those repercussions mainly in the caseload in ASK and the types of cases we're getting that we didn't see before.
Well, and so it's a critically important organization that you've started. And so I'm interested to know what you feel like the longevity is to it from your point of view. You are approaching your senior year in high school. And so what do you feel like the future of ASK looks like? Do you find a way to hand it off to someone else, or continue it along, perhaps with your post-high school plans, whatever those may be?
Yeah, so I hope to continue ASK, to keep it growing, to keep it evolving. As I go to college, there will be so many more opportunities to find new people, new specialists to help work in ASK. I've been brainstorming ideas to maybe get medical students involved so that it could be a learning opportunity as well as a way to serve these underserved communities and empower these local healthcare workers. So I absolutely foresee ASK continuing and growing with me and, hopefully with others as well. getting more students involved, more specialists, more healthcare workers, and I guess continually expanding.
And so what do the post high school plans look like for you? I know you mentioned before we were recording it's vastly too early to make a decision, let alone exactly apply to schools. But what type of field of study are you considering, and maybe what part of the U.S. or international might you consider going to?
Through Ask, I've become so interested and so passionate about public health. So in college, I hope to major in public health. And from there, I hope to go to medical school to be able to be one of the people who are able to contribute to solving cases, not just forwarding them, but actually having the power to, make an impact and help and empower many of these local healthcare workers. As for college plans, I've been looking in-state as well as out-of-state, seeing wherever I could get the best education, to get the most diverse opinions, the most diverse thinking, to really help, broaden my worldview and kind of get, I guess, a more nuanced understanding and more complex ideas, and to help further Ask as well as myself.
Mm. Well, and Ariana, what do you feel like you've learned about yourself in these last few years, both starting and continuing to sustain Ask, looking back at yourself at 14 versus now? What do you feel like has most changed and kind of shaped your perspective in a different way?
Yeah, I think really before starting Ask, I had this perception that, meaningful impact can only occur to people who are the people who are credentialed, who are, the most properly equipped to help, who have this perfectly laid out plan. And, in no means was I equipped to help in this situation. But irrespective of that, I learned that I did and I could. I could seek out the resources, I could seek out the knowledge to make an impact, even though maybe it wasn't the most optimal for me too, right? It didn't seem the most likely, right? So I guess change doesn't wait for somebody who has these credentials. It can occur even with, just this 14-year-old girl feeling helpless in a foreign country. And I think that's been the biggest thing, being brave enough to care and being, bold enough to seek out the resources to really help.
Mm. And I'm interested, what do some of your peers or your fellow students think about Ask? From what I read, some are involved, helping you out with it. But what's their reception like of the work that you've done?
Yeah, so Ask actually so our main model is connecting healthcare workers in underserved regions to medical specialists here in the U.S. But really, there's so many other initiatives that Ask leads. We have an educational branch, we have Neighborhood Health Screening Club, and many other initiatives. And so because of how broad Ask is, many students are involved in helping lead these initiatives and helping building coursework and screening. And I hope to think that I hope to believe that they think that Ask has provided them a lot of opportunities and many avenues to help where they think they otherwise couldn't. Mm. So in the beginning, whether that be forwarding cases, to now building coursework or teaching classes, to screening individuals across Texas, I hope that they believe that Ask has helped them find ways to help uplift public health and health equity.
Mm. And so maybe it's existed mostly off of your donated time and the specialists as well. But has there been any need for fundraising or funds to support the organization's operations just yet? Maybe building the platform that you're describing, perhaps that costs something. But has there been any need to raise money or anything just yet?
So the main model of Ask really operates without any overhead costs. However, we have applied for grants to help continue different initiatives and help lead new initiatives. So recently we got a $10,000 grant from NSHSS, and that was primarily to help us start launching health camps across the previously warring front of the DRC, of like the Democratic Republic of Congo. And kind of what that entails is basically the Democratic Republic of Congo and Rwanda has really been entrenched in this history of, ethnic divides and regional instability, and which has really culminated in very devastating and very severe armed conflict. However, recently a peace treaty was signed. And so now what Ask is doing is we're starting with Ask partnered healthcare workers. We're starting to launch health camps, which are these 2-day pop-up camps where individuals from any side of the war, any background, any ethnicity can come in and receive treatment and receive screenings and receive medications free of cost. And so we've led pilot health camps in Guinea-Bissau before, and we saw that not only did these patients receive care, but it also exponentially increased visits back to the primary clinic. So now we're starting to go through that process in the DRC, and that's primarily where our funds are going to right now, to start this new initiative, to get the medication, to get the screening equipment, and set up the tents so that these individuals can receive the care free of cost.
And what's the reception been like to your age, perhaps in formal grant applications like that one, and otherwise in these interpersonal exchanges? If you have new folks in clinics throughout the DRC, for example, reaching out to you, or other specialists receiving your inquiry about partnering up, what has the feedback been like?
So the very honest answer is that when working online and through emails, I don't mention my age I try not to mention my age as much as possible.
Sure.
Because, that raises a lot of speculation and a lot of questions. However, it's been a lot of trying to build legitimacy beyond that. So one of the things I did was created Ask as a 501c3, registered it as a 501c3, hopefully to allow us to expand to new countries and also gain the trust of new clinics. Because even though these healthcare workers are sending us de-identified cases, there's still cases and there's still patients that are close to their heart, and trust is so integral in that relationship. So to kind of overcome the skepticism that comes with age, it's been legitimizing Ask through various other means, growing the team of very well-certified doctors. And as Ask continues to grow, I think hopefully the legitimacy will also continue to come out as well. And, to be able, so that we can be able to foster more trust and, be able to help those who really need it.
Absolutely. Yeah. Well, Ariana, this one's purely speculative, and I'm just curious to hear your perspective. What's your reflection of the San Antonio community as a young person so invested in public health? What do you see as perhaps the potential for yourself returning back here professionally to work here? I know there's a lot of time between then and now, and much exploration for you in the next few years. But with the expanding, UT Health system, for example, and our growing med center, what's your perspective on our healthcare system currently and the professional prospects down the line?
So I think I really hope to come back to San Antonio in my future. So after wherever I get educated, I would really love to come back to San Antonio, primarily because there's so much left to be done. I feel conversely, I've done a lot in sub-Saharan Africa, but there's still so much more I could do locally. I've led these initiatives globally, but there's so much more I feel as though I can contribute and learn from San Antonio as well. So, Neighborhood Health Screening Club has been the first example of Neighborhood Health Screening Club has been the first instance of me really trying to uplift healthcare inequities locally, and I hope to expand on that and perhaps come back, more educated and with more nuanced ideas and perspectives. So yes, I would absolutely love to come back to San Antonio, and that will likely be a big part of my future as well.
Well, I don't know if you're just telling me what I want to hear, but I appreciate it nonetheless. Last question for you, Ariana. Again, along this point of, just going from, idea and a very emotionally impactful experience that you had when you're 14 to taking action. I appreciate that in a young person like yourself, and I'm sure there's other folks who might be inspired to take similar action themselves on unrelated issues here in the San Antonio area. And so what other piece of advice might you leave them with, that could perhaps spur them into action themselves?
Yeah, I think start small and start now, because, taking action won't wait for anybody else. I think that our generation has so much potential and so many new and creative ideas to make a difference. And I think that being brave enough and being bold enough to reach out and care and learn more is so integral in making a change. And I think, yes, anybody can do it if they just start. So.
Love it. Well, thank you so much. And with that, Ariana, thanks for taking the time to coming on to Big City, Small Town.
Yes, thank you so much for having me.
Thanks for listening to or watching this episode of Big City, Small Town. If you enjoyed it, please send it to a friend, share it with a colleague, helping us to keep telling San Antonio's most meaningful stories. And if you haven't yet, sign up for the San Antonio Something, my weekly newsletter where I share things to do, places to explore, and people to get to know in this city. Just head to CoreyAmes.com to subscribe. Also, be sure to check out Monday Musings, Bob Rivard's weekly newsletter, at bigcitysmalltown.com. Big City Small Town is brought to you by Weston Urban, building the city our children want to call home, and by Geekdom, where startups are born and smart ideas become businesses. Thanks again. We'll see you next time.